Good morning, everyone. Scott Mabor here with your Medicare Missive from the pond for Tuesday, the 2nd of June. Hope you're all doing well. Beautiful day here in Boston. Wanted to revisit a video I did last week. Very nice woman. I'm going to write this up also, but very nice woman. I met with her and her daughter-in-law on Friday morning, and to review her plans. Her Medigap policy had a big price increase, and many of you who are on Medigaps are getting those letters now because most of them renew. Medigaps are typically renewing in June, July, not at the beginning of the year. So even though the open enrollment, although it doesn't apply here, is in the fall for January 1st, these plans typically, it's not that they renew, but their price increases are in June, July. So she has a Plan F, which is an older plan, not offered anymore unless you're grandfathered in, and it's gone up to $350 a month. That's in addition to her $203 a month, and in addition to her drug plan. Now, when I did this video last week, she didn't think she had a drug plan. So we sat down and spread, and she's all paper, no electronics. She has paper files going back about 25 years on her Medicare. She's late 80s. First thing we looked at is her Plan Plan F. And I suggested let's switch it to a Plan G. Plan F to Plan G, almost the identical coverage. The only difference is the deductible, which is just under $300 for the year, is covered on Plan F, not covered on Plan G. It's the only difference between the two plans. However, she's looking at about an $80 a month savings there. So 80 times 12 for the year, you're looking at almost $1,000. The only difference is it's paying a $300 deductible. Makes no sense. We just saved her almost $100 a month, and she's on a very limited income. And she has the same coverage. So she saved money, has pretty much the same coverage, and that helps with her bills. Turns out she does have a drug plan. She didn't think she did. She has one of the most expensive drug plans available in the country. She is paying $155 a month for her drug plan. She takes one drug. She gets it from a Canadian pharmacy because it's cheaper. Very sad. I can't change it right now because it's not open enrollment. But the drug plan I would have recommended for her if we had reviewed this during open enrollment was $8.40 a month. There's $150 a month savings. So now we're up to nearly $250, and the drug would have been cheaper at CVS than it is from Canada. By the way, anybody who's listening to this, if you're on an expensive drug, or it doesn't even have to be crazy expensive, but if you're on a drug, check the Canadian pharmacies. There are a lot of mail order Canadian pharmacies that may save you a bunch of money if you're willing to order from Canada. Depends on what tariffs do, but at the moment, most of them are still cheaper. So that's an option. So then we looked at her finances, and I said, why are you not on any sort of assistance? Based on your income, no assets, can you qualify for some assistance? And I don't think she qualifies for top tier. She's got her husband's Social Security, her deceased husband's Social Security. She has a small pension. She's got a little bit of money in the bank, but not a lot. But I still think she qualifies for something. If she qualifies for something, potentially save her money, depending on what level they give her, but it also gives her an open enrollment, so we could change the drug plan from $155 a month to $8 a month. So if they approve that application, so we actually did a MaHealth application to see if we could get her something through the state. We also tried to do the LIS application, which is federal, but for some reason it wouldn't take her Social Security number. We tried, it was right social. We called, it came up, you have to call this 800 number. We did that and scheduled an appointment. The woman we spoke to wasn't 100% sure why it wouldn't take her social. She confirmed it was accurate. She thinks it's because something with the Social Security coming from the husband's number doesn't make sense to me. But she's got an appointment actually this morning to talk to excuse me, to talk to Social Security to see if she qualifies for the LIS program. If she applies for LIS, there's also other programs that are more generous. Some of them help with just your drug copays. Some of them will pay your drug plan premium, all the way up to full Medicare, no copays, no premiums. I don't think she's got that level, but if she gets any level whatsoever, we have an open enrollment. We can switch her drug plan. That will save her $150 a month. So there's $250 a month we just saved her. I don't think she brings in more than $1,200 a month in income. That's a huge savings. Nobody ever told her to apply for MassHealth or federal subsidies. No one's looked at her drug plan since her husband signed up for it 10 years ago, 20 years ago, whatever it was, and nobody has ever changed her supplement. You have to get help. Just because the plan is working doesn't mean it's the best plan for you. If you could save $250 a month, as this woman can, is it worth it? Is it worth having a meeting with somebody who can walk you through this and explain it and help you make better choices? Let me know if I can help. Let me know if you have any questions. It's what I do. Give me a call. Thanks for watching. Be well.